Thank you very much, everybody, for joining us. Good morning, Africa, and good afternoon if you're on the left-hand side or right-hand side of the continent. We welcome you all back to day 2. As you know, day 1 was an excellent day. It looked at the presence of what we call the past and present of Africa. We saw where the difficulties we had faced during the pandemic. We also saw green shoots of new hope springing up in our health systems, where patients have joined in with the state and with the industry partners to firstly control and then shore up and strengthen systems and provide relief, moral support, mental health care support, and how we have all learned to change our service delivery. We heard cases from Cape to Cairo. Starting from the Cape, we had the South African mental health service, which used shipping containers to deliver services into the community when all healthcare facilities were shut and inaccessible, the roads were inaccessible. Then we saw in Cameroon, in Central Africa, how academics and patients got together to ensure that patients could get the right access, right diagnosis, and make sure that nobody was left out. And during isolation, they went out supporting. We saw then from Ghana, the Africa Healthcare Innovation Center, who was bringing in lots of stuff right now, looking at how we developed that entrepreneurial approach to healthcare innovation, how patients were co-creating solutions, not only with the government, but also with industry partners into looking at new services, new products, new facilities, everything that was leading on. Today, we will look at the future. And I'm so glad that we're starting this session. And I have with me this morning Dr. Marlene Thomas, who is a global head at Roche, Switzerland. Marlene comes with a great pedigree. I mean, when I say this, I mean it truly. Marlene started in the personalized healthcare side of, we're right at the bottom, looking at cancer research and looking at something very specific, clinical biomarker development, and how this could be aided to early diagnosis and very patient-specific diagnosis. This biomarker experience, and I think her first-hand contact with what you call the heterogeneity of populations, made her realize that the future is really personalized. Everything should be targeted to the individual patient, his or her makeup. Marlene has now transited into heading this global patients affairs and the medical affairs personalized healthcare team for almost coming up to 14 years. And she has developed a great insight into what personalized healthcare is and how it can be developed. I would like to invite her to speak on this because we think, just as in the mobile phone technology, where we had a situation develop when people said, oh, it doesn't apply to Africa, oh, there'll be no acceptance in Africa. We say build it and they will come. When the mobile technology was introduced, you suddenly had a huge influx of services that were developed on the back of that. I will now ask Marlene, Dr. Marlene, to start the conference with what personalized healthcare is. Marlene, over to you. Thank you.
off with discussing a bit the why. Why do we see the need for delivering healthcare in a different way as we have done over the past decades? And well, actually, we are at a pivotal moment in healthcare history, because we see an unprecedented convergence of medical knowledge, technology, and data science, how it's revolutionizing patient care. And not just only from that technical perspective, also we observe that the regulatory environment is really adapting innovations much faster and bringing innovations to life. We also see there are new opportunities for forming partnership models in a public-private setting we haven't thought about years before. And with this also kind of enabling access to innovation that was not actually feasible before without those collaboration models. And last but not least, we also see that patients are becoming more health literate and empowered, and really for a good reason, because in the end, care should center about the patient, and therefore we need to have the patient as a core stakeholder, part of the evolution of healthcare, how we develop drugs and solutions for care, but also how we finally implement them and make them accessible. And actually, what has helped, of course, is the digital revolution in healthcare, because it provides now new ways to both collect high quality data from each patient and connect it to data from large pools of other patients. And we see new tools like digital tools, patient monitoring, these wearables where you can track quite some information around yourself, but also your environment. New tools with regards to clinical and diagnostic workup to really learn more about the biology of your disease and describe better your health status. And with this, just now imagine looking at a patient, and each individual colored pixel now represents a piece of the aspect of your health status. It really makes sense if you bring together all these little pieces and pixels to finally describe your health status, and then help the clinician to make actually the right decision based on your next treatment step. And what is also important is if you now compare your color, if you compare the pattern of those individual color dots to the individual next to you, it might look, and for sure it will look totally different, because we are all individuals, and it doesn't mean that we can still continue with this one fits all type of approach when delivering healthcare. So just again highlighting that this is important, that we really start using and implementing these opportunities of having a better picture of health for individual patients and then act on it. And not just at a single moment, this really needs to continue over a long period of time to really make sense out of it. However, on the other side, of course, this puts us in front of new challenges, because we are creating massive amounts of data, and these data need to be processed, and someone needs to be able to read and interpret the data to make meaningful decisions based on it. And just to, again, highlight a bit how really impactful this is, and almost also ask for an urgency to act, is that by 2025, we actually expect that the global volume of healthcare data is projected to reach 10,500 exabytes, which is almost not feasible to understand what this means in really acting on it. And based on that, we of course see now more opportunities to treat patients either in clinical trials or in clinical care, but the physician needs to be aware of these innovations and advancements. So we need more supporting systems that help the clinician also getting awareness about the latest opportunities to treat patients. And in the end, hopefully also guidelines will pick this up in a more timely fashion, so that we don't play catch up with innovation, but really have a formalized way of telling the community what is the current standard of care for individual therapeutic areas. So let's turn these challenges into an opportunity and really rethink and redesign the way care should be delivered. And what we at Roche are now approaching is actually moving away from that traditional way how care is delivered, which, on the left-hand side, you see it's the kind of old ways of linear care planning. You have a diagnosis and then you treat. So it's all about the condition a patient has and follow it without really considering these additional bits and pieces that might be relevant. So therefore, we are moving to a model where the patient is at the center, not the condition, and really trying to figure in information around lifestyle or demographics, or really the opportunity of additional data points that might not directly link to your disease as such, but it could help really predicting how you will respond to a certain treatment or not. So with this more integrated approach of having better diagnosis, having the opportunity to also ensure the access to innovative treatment, but continue the monitoring of the disease, and ultimately also get to a situation where we prevent rather than treat, is something we are now focusing on, and therefore kind of revolutionizing the way how care is delivered. And as I said, it takes a village. This is not feasible by just working in silos and with selected stakeholders in a healthcare environment. So Roche truly believes this can only be realized if we work in an integrated way with all the multiple stakeholders that have a say in a healthcare system. And they all should be considered equally, because they all have their own interpretation of value drivers. A value driver for a caregiver or a patient might not be the same that a policymaker has. So we need to make them talk to each other to really understand the different aspects that drive their thinking, and in the end, how decisions are made. So having said that, I would now really talk a bit more about the how, and also show some examples where we think this could be catalysts of changing care, and especially ultimately get personalized healthcare as an outcome. So as a consequence of a different way delivering care to individual patients. So as I said, for us, it's important to now anchor around the patient, or putting the patient at the center, not the disease itself. And this can only happen if we then make sure that we have those information available that better describes the disease, or in oncology that describes really the molecular makeup of a tumor. Then of course it also needs to identify the potential conditions like risk factors or lifestyle to change the opportunity of providing the right care, but also the technology and the health data to take it into account to understand how specific patients might show up under combination treatments, or when there is the right time to switch or de-escalate treatment strategies. And of course, it needs to be accessible. It doesn't help if this is something that will only work for specific countries or for specific patient populations. We need to make sure that access also means equity to healthcare, and therefore, again, consider this from start. When you start developing solutions for healthcare, you always have to have in mind someone needs to access this in the end. So summarizing then personalized healthcare, what does it really mean, changing the way of care, tailored towards individual patient needs? Is that really it's treating the person, not the condition. And it is giving people more choice and more control about the way they want to experience the treatment and the care they are exposed to, and involving people more in asking, in making decisions about their health and their care. So one example I would like to share is about genomic profiling. So this is a method based on next generation sequencing, where we are now able to look much deeper into the tumor biology of individual patients. And what you then can detect is specific alterations in the DNA of a cancer patient that obviously are relevant for making a tumor grow. So when some of these genomic alterations are the result of cells just growing and getting out of control. And what we've learned by this technology is that it obviously gives you the opportunity to distinguish, again, different tumor types within a single disease. And I picked here the example of lung cancer because for years we have thought, well, there is lung cancer and there is a standard treatment to it. If at all, we had histological subtypes to further separate lung cancer into distinct diseases. But with this new technology, we obviously learn, for example, there can be more types of lung cancer based on the genomic drivers. And you would see now on the right-hand side here that although they all have a lesion in their lung, based on that profile, they have different genomic alterations that show up. And therefore, a clinician would give this lung cancer patient a different treatment approach indicated by drug A, B, or C. And sometimes there is no lesion at all. So you would obviously then go with standard chemotherapy, which is also still a viable opportunity for treating cancer patients. And now kind of understanding better the diversity of cancer as a disease, not just looking at lung, but also looking into it with regards to the different ethnicities, because what we all need to get better when we recruit patients to our clinical trials, we really need to understand where do those patients live and sit that would benefit from being recruited in a clinical trial. And we did in a collaboration with our colleagues from Foundation Medicine in the US, we analyzed a huge data set where we had the opportunity to do ancestry calling. So based on a technical algorithm, we were able to kind of dissect this big data set into patients that came from America, South or East Asia, Africa, Europe. And we could look into those alterations that happen in the genome. And what we could see is now looking at different cancer types like breast, lung, or hematology or prostate, as it is shown on the x-axis, we see that if you look at a specific gene, which is indicated on the top, like NTRK or TMB high, there are variations depending on the ancestry you're looking at. And this is really relevant information because, again, it means a one-fits-all approach does not work. And we should bring the care or the treatment options to patients that really have these alterations and that ultimately hopefully would benefit from those. And to further now build on these insights, which were done based on that data set, we are now currently collaborating with our Roche colleagues in Nigeria to run genomic profile analysis with the same technology now on breast cancer patient samples in collaboration with local physicians to further now correlate those findings out of this database with real world samples out of Nigeria. And another example I brought is from Ghana, where we want to address oncology and healthcare barriers in collaboration with government, patient groups, and healthcare providers, so that ultimately we ensure or we want to help improve access to patient care with an enhanced geographical spread of specialists to patients. And with this, we also hope that we pull down the hurdles for getting innovative medicines to patients. And there are actually 3 more examples I could speak to, but just briefly, and just again, showing the breadth of the opportunities we see from an industry perspective is an example from South Africa, where we help to actually educate and upskill caregivers to be ready to act on these new solutions. Because it doesn't help if this is published somewhere, if a caregiver cannot act on the innovation locally and help patients benefiting from it, it just doesn't help. It's not just worth having it written in a glossy paper. The other example is from the Ivory Coast, where it's all about getting these innovative access models to life with public-private collaborations, as I alluded to in the beginning, and a third example, which is really about having access to diagnostic solutions, which describes the engagement we have with the sub-Saharan region, where it's about giving access to testing modalities like hepatitis or HPV. And so again, highlighting how critical the role of patients are, and the collaboration with patient advocacy groups, we at Roche have developed a platform called International Experience Exchange with Patient Organizations, in short IAPO, which is a global platform of engagement for patient community to co-create and collaborate, and to be strong and impactful partners with an equal voice in dialogue to transform the future of healthcare ecosystems together. And this has been created with patient advocates. So again, it's important that we just don't put our inside view into these tools, but really co-created with those who are the experts and who then are in front of patients to discuss the opportunities to change care and what the future role is. And on this platform, we host the PHC Hub, which is a repository that is accessible to everyone, and all the materials are actually available and can be used. And it's actually a summary of having the narratives that explain the benefits of personalized healthcare. And for example, it has a bucket where you find educational materials for individuals that are affected by certain conditions. It also has a playbook included for health advocates that include helpful resources, guidances, or also best practice examples others could potentially learn from, or at least start learning about. And last but not least, it has, well, it's all summarized in this interactive and open source microsite. So highly encourage everyone to go to this site, and I'm sure Kawaldip also has highlighted the opportunities and the benefits to use these materials. And I would like to really end saying that we at Roche think that we can be a catalyst for the exponential change that advances scientific discovery and improve health for all people in Africa, and really only by building these partnerships and building bridges across these different healthcare stakeholders. Thanks for the opportunity to connect with you all.
Thank you very much, Marlene. That was an exciting overlay of what is going on. And I can tell you that the international patient experience that IEEPO's launch of the Personalized Healthcare Hub and also the material and the toolkit, I was involved with it from day one, and I can assure you, exciting material there. So we had some of the best patient advocates from around the world, from Latin America, right up from Chile, right down south to almost Greenland on the north, and then looking at North America, right down to Japan, and a cross section. And in Africa, we had 7 participants. Please do have a look at that resource. It's open. This morning we shared all the links with you. We will be sharing that later on as well. Please access those resources, and we will develop that into a great idea. Marlene, just one question for you now. It's almost like a statement rather than a question. Firstly, someone says, thank you very much. It's the first time they've seen data from Africa presented to them. Very often they go to, all they wanted to ask is, how can young Africans, as you know, the median age is 19.2, how can young Africans get involved with Roche and personalized healthcare? Is there a pathway they want to follow your example? Thank you.
Absolutely, and I'm excited to hear that people actually have the wish to connect and to see how we together can shape these opportunities. So what I would recommend in a first step is, because Roche has affiliations in many countries in Africa, so it's always good to try to get connected to those colleagues that sit in the country, and they usually are closely connected to us as well. So this is an opportunity, but I mean, meetings like this exactly give the opportunity to also directly connect with us. So I'm more than happy to have you reaching out to me, or having Kawaldip helping to kind of circle this over to the Roche colleagues he now used to know. That would be my advice, simply, yeah.
Thank you very much for that, and thank you very much for your time and audience. And as I said, I'm always happy to push this forward. I'm really pleased, and I think the African genome and phenotype has to be represented in everything we do, from the treatment we do. Thank you very much, Marlene, and have a good day everywhere. Thank you.
Thank you. Enjoy the rest of the meeting. Bye.
Thank you.